G'day guys, Dr. James Simcock here from VetDojo, and just going to run through a couple of CT scans with you of some cases we've had today and yesterday. This first one is a dog that actually showed the surgery on our live stream yesterday, which was a dog with an analsac adenocarcinoma. I'm just going to try and change the factors here, or the adjustment of the contrast on this camera so you can see it a bit better. So what we're looking at is this really large analsac tumour. We've actually got this other thing here, which is on the left side, so the mass on the right side. This other thing here is actually material in the contralateral anal sac, but you can get an indication of how actually big this mass is, and it's really pushing on this rectum quite dramatically. So this mass is about 5.1 centimetres, probably about 5 centimetres in this direction as well. So pushing on the rectum, and we did the surgery, and this thing came out without too many problems. It was relatively mobile. We did have to take out the section of the anal sphincter muscle, probably 160 degrees of the anal sphincter muscle, which we reconstructed, and that all came out without too many problems. And that dog's actually recovered nicely from surgery. He's got anal tone, and I think should do quite nicely. But what I wanted to chat to you about for this video was really just the CT assessment of the local lymph nodes. And so as we scroll kind of cranially here, we can start to see there's one small lymph node here in this sacroiliac region. There's another one here, which is quite a large one, and another smaller one just there. And so when I do these surgeries, I think it is indicated in a lot of these cases to take out the lymph nodes if it's just the lymph nodes that are affected. And that seems to be the case in the majority of these situations where it has spread. So anal sac adenocarcinomas have a tendency to spread in about 50% of cases, but most of the time they'll end up in the lymph nodes and not go any further. So we scanned the rest of this dog's abdomen and had a really close look around and couldn't see any other change in his liver, his spleen. His kidneys looked okay, and so everything else looked okay in this particular scan. We also went through and scanned his chest and just made sure that there was no evidence of any pulmonary metastases, and also looked at the cranial aspect of his chest. So that was the case that we operated on yesterday. I'd encourage you to go and look at the video of the surgery for the removal of the primary tumour. But then one of our other surgeons, Ben, had a case today, another anal sac adenocarcinoma, similar size, and that dog actually had more significant metastases, and that's what I wanted to show you in this next video. So in this case here, what we're looking at, start back at the back. So we've got a left-sided anal sac tumour this time. So I'll just try and change the contrasting on this. See if I can improve that for you. See if I can come closer and make that better. Bear with me, technology. So it's hard to get that to look better. I'll just try and change the windowing here a little bit. So you can see that mass down here in the left side of the perineal region, kind of right next to the colon there. And as we start to scroll further forward, we start to see inside the abdomen again, and we can see more of these enlarged sacroiliac lymph nodes. So we've got this one here, we've got another one which is reasonably large just here, that extends forwards, and we've got another one here. And then as we go further forwards, if they were the only lymph nodes that are involved, then I think this case would be another one that you could recommend taking out the primary tumour and then also taking out these metastases. But this dog actually was interesting because he had distant metastases, so he had other tumours that we could see further on in his abdomen. So the rest of his liver and the spleen looked fine, but when we actually continued the scan into his chest, we can change the windowing on here, and we don't see any obvious pulmonary metastasis in the lung tissue. But when we get to the cranial aspect of the chest, we can see this huge mass here, which is a substernal lymph node. And that is going to be enlarged because of metastasis from the anal sac tumour to that location. So I've seen this a couple of times before. And when we have these distant metastases, in these cases, I don't generally recommend surgery on the primary tumour unless it's causing issues with obstipation. However, in this particular case, one thing that we could look at is the use of Palladia, which is a tyrosine kinase inhibitor. And I have had some pretty good success, and I think there's some information coming out, studies being reported about its use for anal sac adenocarcinoma. But it can definitely slow these things down, cause them to go into partial remission, in some cases full remission for quite a durable period of time. So Palladia can be quite useful in these cases where they've spread from the primary tumour past the local lymph nodes to further up into the abdomen. Again, if these cases are limited to just the primary tumour and spread to the local lymph nodes, then in most of these cases we'd recommend just doing surgery on the primary tumour, take out the local lymph nodes as well, and that can give quite a durable remission for those cases. So a couple of cases back to back that were kind of interesting with some quite different CT imaging, and just again a reminder that it's important to look at the whole dog when we're doing this staging and look for evidence of spread through the whole body. So I hope that was interesting. Hope you guys have a great weekend. I'm going to sign out here, but we'll see you all soon.